Gentlemen, let me ask you something very personal. Have you ever woken up in the morning, rolled over, and realized that something you once trusted as a natural sign of vitality is simply not there anymore? That firm morning greeting, the one that used to be as reliable as the sunrise, has become weaker, less frequent, or perhaps disappeared altogether. And in that quiet moment, you wonder to yourself, is this just aging? Or is my body trying to tell me something more? I am Dr. Evelyn Grace Morgan, a urologist who has spent decades helping men over 60 protect their prostate, restore their performance, and feel confident again. And today, I want to share something very practical and very real with you. Three secret pressure points, points you can stimulate with your own hands that can help wake up your body's natural erection mechanism. By the end of this conversation, you will understand why morning erections fade, how these points influence blood flow and nerve signals, and how to use them safely and consistently to bring back strength and reliability in your mornings. So stay with me until the end, because this is not just about function. It is about confidence, about intimacy, and about reminding yourself that your body is still capable of vitality when given the right care. Morning erections are not random, and they are not just a curiosity of male biology. They are, in fact, one of the most important silent indicators of your health. They show that your blood vessels are open, your nerves are responsive, and your hormones are active. When they fade, it is not simply because of age. It is a signal that circulation, nerves, or hormones need attention. Think of them as your body's daily report card. A strong morning erection tells you that your system is working in harmony. A fading one is a message that something is out of balance. And the beauty of that message is this: it gives you an opportunity to respond, to strengthen, and to restore. And let me reassure you of something important. Losing morning erections does not mean you have lost your masculinity or that your body has given up on you. It simply means one or more of your vital systems, your blood vessels, your hormones, or your nerves, are asking for care. When you take that signal seriously, you gain the opportunity to not only restore stronger erections, but also to improve your overall health. Because the same changes that support morning erections, better circulation, balanced hormones, and sharp nerve function, also support your heart, your brain, and your energy for years to come. Now, let us talk about why pressure points matter. Erections are a dance between blood flow, nerves, and muscle support. When you stimulate specific areas around the base, beneath, and just below the head of the penis, you are activating clusters of sensory nerves and circulation hubs that feed directly into the reflex centers controlling erections. Imagine flipping a breaker switch in your house when the lights go out. The wiring is all still there, but sometimes the signal needs to be reset. Pressure point stimulation works in the same way. It bypasses some of the slowdowns of aging by sending a clear, direct wake up call through your nervous system, reminding your body of its natural capacity. And here is the deeper beauty of this approach: you are not forcing your body with a pill or an artificial aid. You are reminding your body of a natural process it already knows how to perform. By reawakening nerves, encouraging blood vessels to relax, and engaging pelvic floor muscles, you essentially retrain your system to respond the way it did when you were younger. With consistent practice, these signals grow stronger, sensitivity improves, and the confidence that comes with reliable erections slowly returns. The first pressure point is located where the shaft of the penis meets the pubic area. If you gently run your fingers along the underside of the shaft toward your body, you will feel a subtle groove or hinge-like area. That is the base groove. Why is it important? Because right beneath this spot lies a crossroads of nerve endings and blood vessels. Stimulating it helps both systems at once. The nerves fire more readily, and the blood vessels open more fully. It is like pressing a reset button that wakes up communication between your circulation and your nervous system. To stimulate it, gently place your thumb over the groove while cradling the shaft with your fingers. Apply small, steady circular motions with enough firmness to feel the tissue beneath, but never to the point of pain. As you do this, you may notice a warmth, a tingling, or even a gentle fullness starting to build. That is your body's signal that circulation is opening. Over weeks of practice, this point becomes more responsive, and your morning erections become more reliable. Think of it as exercise for the erectile system. Small, regular reminders that keep the pathways alive. And the more consistent you are, the more lasting the effect becomes because this practice not only boosts immediate blood flow, but also trains your nerves and vessels to stay active and flexible with time. The second point lies just beneath the scrotum, in the soft patch of tissue between the scrotum and the anus, known as the perineum. Many men overlook this area, but it is one of the most powerful zones for erectile strength because it connects directly to the muscles and nerves that control blood flow and firmness. Directly beneath the perineum is the bulbospongiosus muscle, part of your pelvic floor. This muscle is responsible for trapping blood in the penis during an erection, essentially acting like a natural clamp to hold firmness steady. When it is weak or inactive, erections fade too quickly. But when it is engaged and strengthened, they last longer and feel more powerful, giving you both physical strength and a sense of renewed confidence. To activate this area, use two fingers to apply gentle but steady pressure to the center of the perineum, moving in small circles. As you massage, you may feel warmth, tingling, or even a subtle pulsing sensation beneath your fingers. That is your pelvic floor waking up and responding. Done daily, this strengthens the very muscle that keeps your erection steady once it begins, creating a stronger foundation for both morning erections and intimacy later in the day. And here is the extra benefit. Regular stimulation of this area does more than just boost erections. It helps retrain your pelvic floor muscles, improving bladder control and circulation throughout the pelvis. Many men I have worked with notice that not only do their erections become stronger, but their nighttime bathroom trips decrease, and they feel lighter and more at ease in the pelvic region. It is a small habit, but when done consistently, it supports both your prostate health and your sexual vitality. The third point is located just below the head of the penis, along the ridge where the glans meets the shaft, known as the corona. This ring is packed with sensory nerve endings, and stimulating it helps sharpen the nerve signals that trigger erections. To work this point, gently pinch the ridge between your thumb and forefinger for about 5 seconds, then slowly release. Repeat this hold and release pattern for a minute, then switch to gentle circular motions around the ridge. The goal is not to overwhelm the nerves, but to recondition them to fire more quickly and more effectively. Over time, this practice makes arousal signals faster and more reliable, bringing back that automatic firmness many men thought was gone for good. Now, here's where the routine becomes powerful. Begin with the base groove, move to the perineum, and finish with the corona. Spend just a few minutes on each, every day, ideally in the morning or in a warm shower when your body is relaxed. This short sequence reawakens blood flow, strengthens pelvic support, and sharpens nerve communication. Like any retraining, consistency matters more than intensity. The goal is not to force quick results, but to remind your body of its natural rhythm. Over weeks, most men notice warmth, fullness, and eventually, the return of stronger morning erections. And here is the encouraging part. Once your body begins to respond, the effects often ripple into other areas of life. Men who stay consistent with this routine frequently report better bladder control, fewer nighttime bathroom trips, more energy during the day, and a greater sense of confidence in their intimacy. What starts as a few minutes of focused attention can lead to lasting improvements in both your health and your quality of life. Of course, pressure points alone are not magic. They are part of a bigger picture. Staying hydrated, eating foods that support circulation like leafy greens and salmon, breaking up long periods of sitting with short walks, all of these create an environment where your prostate and penis thrive. Think of the points as turning the key, while lifestyle habits keep the engine running smoothly. And here is what I tell my patients most often. It is not about perfection, it is about consistency. You do not need to overhaul your entire lifestyle overnight. Small, steady steps, like a daily walk after dinner, an extra glass of water in the afternoon, or swapping fried food for olive oil, make the difference over time. When you pair these habits with pressure point stimulation, you are giving your body both the immediate reminder and the long term support it needs to restore firmness and vitality naturally. Gentlemen, here is what I want you to remember. The fading of morning erections is not a final sentence. It is a signal that your body needs care, and a reminder that with the right habits, the right nourishment, and the right stimulation, you can restore what you thought was lost. By pressing these three secret pressure points daily, you give yourself the chance to retrain your system naturally, safely, and effectively. And the results go far beyond the bedroom. They bring back confidence, energy, and the reassurance that your body is still capable of strength and vitality. If this conversation spoke to you, I invite you to subscribe to this channel. Every day, I share practical, compassionate advice for men over 60 who want to protect their prostate, restore their performance, and feel alive again. I am Dr. Evelyn Grace Morgan, and I want you to remember this. Your best years are not behind you. They are ahead, waiting if you choose to take the small steps that bring your body back to life.